Good afternoon. Let me encourage you that should you ever have occasion to be introduced by anyone, ask for Charlotte. That was such a wonderful introduction. I might ask you to do it again. I'm delighted to be here and to have a chance to serve as moderator of this conversation this afternoon. I would be remiss were I not to acknowledge that I am always delighted to come to Little Rock for any number of reasons. But reason number one is because Little Rock has stolen the time, the talent, and seemingly the heart of my little sister, Dr. Cherise West Scantlebury. Now, let me confess that calling Cherise my little sister is purely unauthorized. Cherise never gave me permission to be her older brother. It is a role I assumed, perhaps even over her objection. But you know, when you're a law professor, people keep telling you that you're smart, right? And one of the reasons why it doesn't go to my head is because I've got two sisters who are smarter than I am and never fail to remind me of that. And so part of my role growing up with two very smart sisters was to recognize that as an older brother, what I could and should do was to make sure they had the opportunity to demonstrate to the world how smart they were. So when I got to the Casey Foundation and met a young woman who looked very much like one of my sisters and who was certainly as smart as that sister, I decided that I had found a sister, and that was Cherise, and there were many times when she regretted it immensely. Anyway, I'm delighted to be here and to have a chance. As Charlotte said, I'm now a parolee from Philanthropy, and I'm really pleased and honored that Charlotte is providing a halfway house for me during my period of re-entry. This is what it is. And I'm delighted to have a chance to be here today to say that the campaign for grade level reading, which both Charlotte and Cherise remember, when a decade ago, as they were taking up new roles, I was still thinking about what this third grade reading could be. And what we now have is a movement across the country where folks in red states and purple states, in rural and urban and suburban America, in 340 communities in 42 states across the country, Washington, D.C., Puerto Rico, and the U.S. Virgin Islands have put a stake in the ground saying that they intend to do something in their communities and states about grade level reading. We have a network of communities that have taken that aspiration and moved it to action. And we have coalitions of funders in most of these communities working on it. And I could tell you that not only were the folks at the Winthrop Rockefeller Foundation patient listeners when this was just an idea, but I remember having an early conversation with Royce as she chaired, and she says, "Now tell me what this is." And Roy has this ability to look at you and through you simultaneously. And she says, "Tell me what this is." And I tried my best to explain it to her. Because Cherise, as much as anyone else, with the support of Corey, who had been a friend long, 20 years ago at Casey, took up this agenda here in Arkansas. and has made Arkansas, in many respects, the model for the campaign all across the nation. And that's why I'm delighted to be here today to say thank you to Cherise, thank you to Corey, thank you to Angela, thank you very much, Andrew, and all of you who have worked on the Arkansas campaign for grade level reading. You have made us proud, you have made us better for it. And as we think about the campaign mobilizing folks around the nation, we carry the Arkansas materials, we carry the Arkansas messages, we carry the Arkansas spirit, and we carry the Arkansas lessons. And some of those lessons have been not just stories about success, but lessons learned the hard way. Lessons learned because not everything we tried worked as well as we had hoped, and some things we tried worked better than we had anticipated. And so this afternoon, as we circle back to take a look at the Arkansas campaign for grade level reading, I am absolutely delighted to have Johnny Key, Commissioner of Arkansas Department of Education, Dr. Chad Rodgers, a pediatrician at the Little Rock Pediatric Clinic, who's vice chair of the Arkansas affiliate of the American Academy of Pediatrics and medical director of the Arkansas Foundation for Medical Care. Susan Underwood, Arkansas Better Chance for Education, and she's the instruction manager for the Division of Child Care and Early Childhood Education, the Arkansas Department of Human Services. And when I saw this long title, I said, what is the most important thing? She says, I'm an educator and a learner. That's all you need to know, and I love that. And of course, Angela Duran, who is the campaign manager of the Arkansas Campaign for Grade Level Reading, upon whom we depend so much and so often that I'm afraid that Cherise is going to begin to charge me for a portion of her salary. So let us begin, and I'm going to ask Angela to tell us a bit about the goals, the focus areas. Tell us a bit about the Arkansas campaign, if you would.
So in Arkansas, we have the Arkansas Campaign for Grade Level Reading. We're proud to be part of the broader national effort. And we have set a goal here in Arkansas that every child in this state will read on grade level. And we've done that because we know that if children are not reading right now, then they are not going to be prepared to succeed in the workforce by 2030. And that is important to the success of our state. But we know we have a long way to go. Right now, 37% of our third graders in Arkansas are reading on grade level, just 37%. So that's okay. We have an all-hands-on-deck comprehensive approach. We are focused on parent and community engagement. We want to make sure that children are ready for kindergarten when they get there. We have been working with Commissioner Key on making sure that in the classroom, the teachers have the skills they need to make sure kids are reading. We want to reduce chronic absence, and we also want to figure out how to stop the summer slide.
That's a pretty tight summary of a whole lot of, I'm sorry. When you run around the country, they're pinning mics on you and taking mics off you. All you want to do is to be clear that you're mic'd at all times. So Angela, let me go back and just say that was a pretty tight summary of the campaign. I'm going to ask you to push a little more, and to push a little more on a couple of areas, with one in particular. I think Winston Churchill is always credited with saying that Americans can be counted upon always to do the right thing, but only after they've tried everything else. And it really wasn't Winston Churchill. We give him more credit than he deserves. I think it was more Abba Eban, not Churchill. But I always loved that, and it's so apt here because we have tried a whole lot of things, and we've tried end-arounds and run-arounds and work-around when it comes to parents. And I know here in Arkansas that the Arkansas campaign has taken up this issue of parents and taken up directly. Talk a little bit about that with us.
So we put parents first when we talk about the strategies that we focus on. And what we're really trying to do is we know that parents are a child's first teacher, and we want to empower them and give them the tools and the resources and the support so they can engage with their children and really understand child development and learning. But we also want to make sure that it's fun. We want to make sure that the community is engaged and are doing that in fun and easy ways. We know that schools with strong parent-community ties are 10 times more likely to see improvements in math and 4 times more likely to see improvements in reading. And just to give you a couple of examples, we have partnered with the Clinton Foundation and their Too Small to Fail effort to give parents tools and tips for engaging their babies and talking and reading and singing as part of a pilot effort here in Little Rock of Talking is Teaching, Talk, Read, Sing. Our partners up in Springdale and One Community Reads have been doing work with newcomer parents, Hispanic and Marshallese parents, to help them understand what their children are learning and figure out how to engage with them at home. And then right here, I see Charlie Conklin right there, we've got Our Kids Read has found a very fun and easy way to engage folks with tutoring children. There are 400 tutors here in Pulaski County working with 800 students to help get them on grade level reading.
Thanks, Angela. You know, at the campaign across the country, we were able to see about 100 individual communities report some progress. And the progress was relatively small increments. So we decided to push a bit. And looking here in Arkansas, we had the courage to say, look, we see 2 principal determinants of early school success as measured by grade level reading and grade level math. The 2 key determinants were 1, parents succeeded, and the second is really health, healthy child development. And that's why I'm really pleased, Dr. Rodgers, to ask you to talk a bit about where health plays into this larger strategy around grade level reading here in Arkansas.
Yeah, thanks for having me here today. Glad to represent pediatricians, and when I talk the next few minutes, I'll mention pediatrician. But when I say pediatrician, I mean that to be an inclusive term of family doctors, nurse practitioners, anyone who sort of is a healthcare provider for children. So I don't mean to be exclusive. I just think pediatricians are the best. I'm not biased at all. But we are uniquely positioned in a family to be sort of that first person that the family looks to. And as Angela said, you know, the parents are the first teachers. And so we have a unique approach that we're there the very first day of life. We're often walking the room. We're the first person that parent has to ask about their child, and they look to you to sort of guide them to make sure that their child is healthiest. And so I often say, what's the number one thing I can do to get my child ready for school? That's a very common question. Well child visits. And because of well child visits, you know, are very frequent in the first 5 years of life, especially in the first year of life. It's very intense, as Wes knows, making regular visits to the pediatrician. they're often looking to you to sort of help build that. So there's a lot of important screenings that kind of go on in place for those. I mean, number one, we want to make sure that child is the healthiest child that they can be. Even in children with special care needs, we need to maximize their health. And that's best done through routine screening, health screenings, making sure they're growing well. I think one thing we're really challenged with here in Arkansas is food insecurity, making sure children are getting the nutrition they need in the first 5 years of life to be healthy and ready to learn. And I think there's also a lot of social emotional development that we could do a better job at as pediatricians, just helping parents kind of know the importance of that early engagement, early book sharing, when they're not just making positive remarks to their child when there's those time in periods and not those always a negative experience and when they're in timeout. And those are all kind of important developmental milestones that those kids need to reach in order to be prepared for when they enter kindergarten. Of course, pediatricians are big advocates for quality pre-K, and certainly we love to see all kids in some sort of quality pre-K, but a lot of kids never have any sort of intervention with a child care specialist except for their pediatrician. So that's where developmental screenings become very important. And so AAP actually recommends regular developmental screening using a standardized tool at well child visits in which the parents can see what their child is doing, and we can hopefully identify things early. We know that early detection is the best because that's where you can make the most maximal impact and have the greatest intervention. And begin to get those referrals in place to get children where they need to be so that they're best prepared when they do walk in that door at kindergarten.
Let me ask you to build on that a bit, because what we know is too many children show up to the first day of school with undetected, untreated vision and hearing impairments, social emotional challenges, developmental delays. And I take it that you're a proponent of screening, but what do we really need to do if we're going to dramatically reduce the number of kids who get to the school door?
Right. I think what we know is that we're lagging behind in Arkansas in our developmental screens, that the majority of our children are actually seen by family practitioners around the state, nurse practitioners, and pediatricians are pretty heavily concentrated here in Arkansas. And even traditionally, I think pediatricians have sort of, their developmental screen is, can you walk, can you talk, can you stack a block? And there's a lot of research to show that that is not a good developmental screen. There is a wide array of developmental screening tools that are available. The AAP recommends that you use a standardized screening tool at routine well child interval visits, including things like the ASQ, which I think is probably Ages and Stages Questionnaire, which I think is the most commonly used. There's a lot of different formats that are available for that. Also, screening for autism at 18 months and 2 years of age. Those are kind of important developmental screenings. But really systematically implementing that into pediatric practice throughout the state so that kids are not missed. It's pretty obvious that a large number of kids enter into developmental therapies through many different doors. And we kind of think the best door is, of course, that child be identified at a well child visit where they're getting their kind of routine checkup. And where an Ages and Stages Questionnaire would be given to the family so that even mild delays typically are the ones that are the most missed by pediatrician. There's a lot of kind of steps once that child is identified, and the ASQ, sorry, that's what I use the most, so that's the one I'm going to refer to, that child is referred into a well-qualified developmental treatment program, and that the pediatrician is made aware of what services their child is getting so that they can work with the family to make sure that that kid is getting the maximal amount of therapy. We definitely sort of have a referral process problem here in Arkansas. Really should be more systematic. There are things in place to provide that, but we have traditionally kind of referred to services that we know of, and sometimes the family just seeks it out themselves. And so that's where kind of some communication problems develop. And then as far as when that kid kind of moves through and how they're progressing through therapy. What point are they kind of done, and then when have they caught up? And we have just not really closed that loop on referrals. We don't have a good communication process in place, so definitely can improve. In my own practice, we implemented the Ages and Stages Questionnaire. We actually use a template-based, it's an iPad that the parents can fill out while they're waiting in the waiting room. They also have an opportunity to fill it out beforehand, so many times they're able to look at that developmental screen and see what their child is doing, and it kind of promotes good discussion within the well-child visit. It also is a good economy of time because, to ask the parents all those questions obviously would take up a lot of time, and you really want to focus on what the parents are most worried about and not spend a lot of time asking a bunch of questions. Then it's kind of graded, and we can look at it and we can review it with the family at the time. We also do a depression screen and our MCHAT screen and some other depression and anxiety screens for older children. So it's been a really helpful tool in identifying those patients. I think the biggest threat is that we don't screen and we miss those kids that have mild developmental issues or having behavioral health problems, because many times parents just think these things are normal because that's the environment that they grew up in and that their kids grew up in. And so by using these standardized screens, you can pick up on those kids earlier. The other thing is, for those kids that are picked up in the community and then referred to you, if you don't have a really good standardized screen within your record to refer to, you don't even know what you did in that visit. We just see hundreds of kids a day. So it's a really helpful tool on the other end too, for us to be able to look at that and say, well, the kid was screened for developmental issues and the kid was doing well, and I think they're fine, and I'll see him back in 6 months. But we could definitely improve across the state of Arkansas in kind of implementing a standardized screen. One of the biggest issues too is it does take some time. It takes its nursing time, it takes physician time, and those are screens that we don't get paid for. So they're kind of just supplemental. That could probably be one of the biggest barriers to sort of implementing those into practices and getting people to do those more routinely.
Thank you for that. And I just want to say that within the next several months, you're going to get some really good news on this, because across the country, educator organizations led by the teacher unions are really going to come out very strongly endorsing this whole notion of surveillance and screening, and really noting how much better prepared teachers would be to calibrate the instruction to individual children if they had this information on every child. And there's a conversation going on right now in which we're participating, which I think will lend strong support for the argument you're making and will bring more visibility to the data sharing challenges and the like. So stay tuned on that. I'm coming over to the educator and learner here, and the science is confirming what experience tells us and what common sense suggests. If you care about kids reading proficiently at the end of third grade or experiencing early school success, you're not going to be able to start in third grade, second grade, first grade, or kindergarten. That you're going to have to start much younger. And I know while in Arkansas, there are those of you who are pushing really hard for a more comprehensive system, for more resources in that system. I know there are some tough arguments and really important advocacy going on, but what you ought to know from outside Arkansas, there are many of us who really admire, appreciate, and are hoping to emulate what you're already doing in this state. Now, in my own state, I know everything that's wrong and not often focus on what's going on that's right and that's helpful and is really a marker of progress. Here in Arkansas, you've got some markers of progress, you've got some things upon which to build, which makes the argument for even more advocacy. So Suzanne, I'm going to ask you to talk a bit about the Arkansas approach to early childhood development, early childhood care, and early childhood education.
I'm glad they left me a lot of time because I've got a lot of notes here. When I look across the room, I see a lot of our partners. And many of you were those that saw the vision of what pre-K could be in Arkansas. And many of you have come on board a little later on, and you know what can work. Well, let me give you just a little bit of background. Arkansas began the Arkansas Better Chance in 1991. Now, does it look like it did back then? No, we've learned a lot of things. Right now, we're serving birth through 5, around 26,000 children. Of those, there's around 600 to 700 that are infants and toddlers. Now, you may hear like old money, new money. There's 2 pots of money, so we can serve children. And as that came along, we also implemented something that's called Better Beginnings. It's a quality rating scale. So these programs can earn these ratings that will help them be of a higher quality. And also parents. You'll see parents get online and they'll look and see, okay, which program do I want my child in? Well, that doesn't even have a 1-star. That one has a 2-star. Hey, I like that one. That has a 3-star. So we're working on that. Is it the best it can be? Not yet. We're still working on that to increase that. I don't know that if you know this. We were just recently awarded a federal early Head Start grant. So that gives us the opportunity to serve even more infants and toddlers at quality centers. We're going to be able to serve another 168 infants and toddlers. That's birth through 36 months. They're going to be in 3 different community hubs, and of those hubs, there's going to be 9 partners. You say 168 kids, that's not a lot, but it's more than what we're doing now. We've got to start somewhere. Another piece that we have is the federal pre-K. It's out of the Child Care Development Funds, the CCDF funds. We have around 1,200 children that we are providing pre-K services through with the CCDF funds. And we just recently were going to be implementing layering funds for more infants and toddlers through that. We're looking at these ABC programs that are of higher quality, that are highest quality. So we have around, we were trying to estimate it today. It depends on if they qualify for those programs, around 200 to 300 more infants and toddlers that will be able to serve for that. And if you've been out in the communities, that's one of the things that people are crying for. We need quality centers for our younger ones. Another one of our partners is from the Northwest Arkansas in Benton and Washington County is the Endeavour Foundation. Endeavour has seen the need, especially in Northwest Arkansas, and they have stepped up to the plate, and they're providing funds for additional 700 children, preschool children. 3 years ago, we received a grant called the Preschool Development Grant. That's a federal grant. We're going into we're in our 3rd year now, so we have 1 more year. So what does that mean? Well, we looked at our ABC programs, and again, those that are excelling and that are at a high level, what can we do to improve? Going along with what the federal education and the federal health department said, we need to look at not only serving more children, that's a need, but what about the quality of the teachers? So we had to step up to the plate. We were going to be hiring teachers of higher quality, and the parapro, the aide that's in the room. You know, a lot of times we don't want just a warm body in the room. We want somebody that has that background and that vision and that training in order to help our children too. So with the PDG funds, we have 16 programs agencies across the state. We're serving, we've been able to improve services for over 1,500 4-year-olds and additional over 1,300 new 4-year-olds. with this grant. So you have higher quality teachers. Another aspect, you'll understand this, we also do the vision and the hearing screening and the developmental screening and all of our ABC, the CCDF, Head Start programs. But with PDG, we said there's something more to it. What about dental? So we do dental screenings. Do you know some of these programs, Commissioner Keys, they're not happy with just doing their PDG children. If it's good for them, why not for everybody in the center? So they've stepped up to do dental screenings. We've had dentists all over the state volunteer to come in and help do that. We've also done mental health screenings with the children. That's one of the things we've really had to really look at on that. One other aspect on the PDG are family service staff. I know, Commissioner Key, we've been talking about social workers. Most school districts, well, I guess all school districts have school counselors. Well, in the preschool program, we don't always have that aspect to have a counselor for the children. So we've hired family service workers or staff to work with these children, not just the children, but the families of the children too. So that's one of the pieces there. You know, family engagement is critical to a healthy child development and school readiness. Research tells us that the quality family engagement can have a lasting effect on the child's health, school readiness, and later on success in life. So we're supporting the children while partnering with a home, with the family. We engage, we empower the parents, and we build their capacity as that child's first teacher. So we're trying to help close that achievement gap and prepare the preschoolers for success on in the future in school. Well, then you probably have heard about home visiting. We also support HIPPY, which is the Home Instruction for Parents and Preschool Youngsters, PAT, which is Parents as Teachers, and then, as I said, PDG, the family service staff goes into the home and works with the families too and supports them that way. Some of the other pieces that we were able to do because of partners like you guys out here and because of the Rockefeller Foundation, we were able this last year to create and complete the Arkansas Child Development and Early Learning Standards, that's birth through 60 months. Now, this was not just a little whim, but we had a committee that came together, early childhood experts. Then after they worked for several months putting this all together, it was reviewed and revised by national early childhood experts. So it's online, there's statewide training for the staff to go through that. It is also a continuum of the Arkansas Academic Standard Curriculum Frameworks for Kindergarten. It connects with the kindergarten readiness indicators, and it's aligned with the early Head Start early learning outcome frameworks. In addition to that, we also do family engagement frameworks. We have the Fatherhood Initiative, and we've been working along with Department of Education on the new kindergarten entry assessments. Our dream and goal is that our pre-K teachers will be communicating with the kindergarten teachers, and we'll be working together as a team, not just handing off things or papers or children, but we'll really be working as a team to plan and do that together.
Thank you. Now that's impressive stuff, but I know for every advocate in the audience that say, that's really good, now what have you done for me lately? What's next and what's more and what's better? So thank you very much. You know, we have been so pleased by the response to the campaign by governors across the country. And whether they're Republicans or Democrats, governors have really responded and put a stake in the ground around the campaign. And I knew there had been a gubernatorial change in Arkansas, so I must admit that when I got to Denver this past June and had a chance to meet Governor Hutchinson, I was a little, I didn't want to be too enthusiastic because I didn't really know where he was because I wasn't following it as closely as I should have been. And I must say I had a chance to sit and listen to him. And he must have spent a whole lot of time with Andrew and Angela and Sharice and Charlotte, because he was on message. He was totally on message. He had the Kool-Aid, and he was really sharing with other governors as to why this work was important, and he was especially proud of RISE Arkansas. And I didn't, things were going so well, I didn't bother to ask him what it was. I just thought whatever it was, it's probably really good. So I was delighted when I found out that Commissioner Key would be here today to tell us a little bit about RISE Arkansas, what it is, what its intentions are, and why you're optimistic about where it's going.
Well, the word you just used, optimistic, is one that really fits my feeling about this initiative. When I first assumed this position, the governor brought me in very early in my tenure and said, Johnny, I want us to do something big on reading. We really need to focus on that third grade reading. We've been doing a lot of work. You all know we've been doing a lot of work over the last several years. So taking that directive from the governor, I took it back to my team and said, we need to come up with something big. And in January, we announced our RISE Arkansas. And RISE is Reading Initiative for Student Excellence. Since I took this position, I began talking about excellence. In pre-K and ABC, we've talked about excellence there. In all aspects of education, we have talked about excellence. And reading needs to be right there at the heart of everything else, because without that foundation, we're going to be limiting our students and limiting our success of our state. What RISE does, it has 3 primary goals, and these aren't goals that we're going to be static. They're goals that are going to grow. But one goal is based on what Angela said earlier, in our, where we are in reading is we want to increase the number of students that are meeting the reading readiness benchmark on the ACT Aspire, that's grades 3 through 8, by 10% in 3 years. At the high school level, ACT, we want to increase the number of graduates that are meeting the reading readiness benchmarks by 10% in 5 years. And the biggest one, because this is the one that's important to people like you, Randy Zook, and the folks who look at economic development, and that's NAEP. That's the National Assessment for Education Progress. Educators and business leaders look at that, and they make decisions based on where we are. And in 5 years, we want to move into the middle third. We're in the lower third and have been for a long time, and we want to move into that middle third of states. But once we hit that, we're going to revise our goals, and we're going to keep moving up. And why is that important? By 2030, Angela mentioned 2030, in our ESSA plan, the Every Student Succeeds Act, by school year 2029, which will then be analyzed in 2030, we want to have 80% of our students meeting those highest levels of academic achievement based on the ACT Aspire assessment. And that's doable. That's doable when you break it into smaller bites and breaking it down into what communities can do, and that's another part of the RISE initiative. It's to give teachers better tools, better instructional capabilities, increasing their ability to deliver in the classroom the type of educational system that will help students read. We also want to create RISE communities, RISE schools. We started this year with a cohort of around 1,000 teachers. We have gone out and trained 40 specialists in the science of reading. Each of those 40 are working with a group of 25 educators at the elementary level. Next year, we're going to add another group of 40 trainers and another group of 1,000 educators. The third year, we're going to do the same thing. That's at elementary. In the second year, we're going to add middle school to that component. Because what do you do with those kids? We're going to get those kids off to a good start, but we have kids that are coming into high school 3-4 years behind where they need to be. We have to meet the needs of all those students. And we have to do that through partnerships. And one of the things that we have made at the top of our list is working with our higher education partners so that they are preparing teachers to be able to go into that classroom, working with our legislators. I know Senator Elliott is here, and she and I was happy to team up with her in 2013 on dyslexia. That's when we first really started hearing about this thing called the science of reading. How many of you have heard of the science of reading? Okay, the rest of you need to Google it, all right? The science of reading. Some look at it as a way to benefit kids with dyslexia. It goes so much deeper than that. Someone else mentioned, if it's good enough for the kids that are struggling, it's good enough for all kids. That's what we have to do, or look at the ways that we can tap into brain research, put that into the classroom, and give those teachers sharpened tools for instruction. And that's where we are. That we're really just getting started within the first year of that, but we're really excited and optimistic of where that's headed and that long-term impact it's going to have to our state.
Well, I need to tell you, don't feel the pressure, but your governor thinks that this is a winner, and he's telling other people outside the state about it. So if you stay optimistic, but I think you better deliver, because if you don't, I think your governor's going to have something to say. Let me ask you about this now. You know, we try so hard to get it right in the classroom. We try so hard to get it right in the school. But what we know is that a large number of kids are chronically absent. They're not at school and they're not in the classroom to benefit from the best of what we're doing. What's happening around chronic absence that you can talk about and would give us some reason to be optimistic?
Yeah, that's a great question, and we have talked about chronic absence for a long time. Sometimes we talk about things so long we don't back it up with tangible actions, things where we can say, this is what we have done. Well, we have submitted in our ESSA plan as one of the indicators of school quality, chronic absenteeism. And schools will be able to demonstrate their effectiveness at reducing chronic absenteeism by some very tangible measures in our ESSA plan. So that's one way. The other way is, and that, you talk about putting the pressure on. Now, when that's in the ESSA plan, that puts some pressure on. But let me tell you where that came from. That came from our stakeholders. That's not something we at the department decided we wanted to do because it was the right thing to do. It was something that our stakeholders said this is the right thing to do. And the feedback around the state was we need to tackle chronic absenteeism. You've heard a lot of the talk of partnerships, and that is one of the ways we are tackling that. I visited a school, Magazine, Arkansas, probably about as small, it is a typical Arkansas small town, and they put in a health clinic in their school. Not only are they seeing reduced absenteeism from their students, they are seeing reduced absenteeism from their teachers because their teachers can access health care for those routine things that happen to everyone without having to leave the classroom for more than an hour a day instead of having to travel to Fort Smith to go see their doctor. You're seeing examples like that all over the state. And I would be remiss if I didn't say one of the other tools that we're doing to help teachers is future teachers, that a reading test so that before they go into the classroom, and this is something that other states have adopted, but really Massachusetts had the model on it, is a test so that they can demonstrate proficiency in teaching reading, knowledge of those concepts. And again, Google, science of reading. It's about brain research. It's about putting that in the classroom. The ESSA plan is really raising this issue up to a higher level. And the partnership with Arkansas Grade Level Reading, partnership with Attendance Works, partnerships with our healthcare partners, partnerships with AR, Our Kids Read, all of those groups, that's what will really move the needle for our kids, because it can't be something that's just centered out of the Department of Education. It has to be something that our communities adopt and embrace. working together. I mean, one saying I heard when I got to the legislature a few years ago was, if you really want to get something done in the state of Arkansas, you have to file a lawsuit. And sadly, we've seen, that play out through our history, especially in education. Well, we wanted to do more than just be a partner. We wanted to be a partner. We wanted to be a supporter, but we wanted to be more than a supporter. And that's where the governor stepped in and said, how can we drive this? What are the things we can do to drive it? Our Rise Arkansas plan is driving it. Our ESSA plan is driving it. And our partnerships and with those community organizations, our healthcare organizations, our business organizations, educators around the state, those are the things that are going to drive our success so that we will meet and exceed our goals. And by 2030, we're going to have what I believe is going to be an education miracle. If you Google the Massachusetts miracle, you're going to read the story about what they did in Massachusetts. I think in 2030, you're going to read about the Arkansas miracle in education. And it's going to be because of the partnerships and the buy-in and the dedication of folks like these folks here to my left and right, but also the organizations that are represented here in this room today. So thank you for giving me a chance to brag on the work that my team is doing with Rise Arkansas.
Commissioner Key wants us back here in 2030, ready for Mardi Gras, right? Angela, I know you've been thinking a lot about getting kids ready for school, getting them to show up to school and be present, and making sure that they don't get on the summer slide. So let me ask you to pull it together for us and talk a little bit about what's happening in all three of those. We've kind of covered two, but what's your take on this?
So just to expand a little bit, I mean, we're definitely thrilled with the leadership of the governor, and we are thrilled to be partnering with the department on chronic absence and excited to see that focus. Our other issue at R5 is summer learning loss. And so what we know from the research is that kids, even if we have these fabulous teachers teaching the science of reading and kids are getting everything they need, if they don't have quality summer learning experiences, they can still be 2 or 3 years behind by the time they reach 5th grade. And so one of the challenges we have is there are very few resources to support summer learning programs. And so our partners at the Arkansas Community Foundation asked us a couple years ago, we want to put a little bit of money into this. Where can we make a difference for like summer? And so we have been demonstrating, we have had 5 grants over the last couple years, all the way from Boonville to Stuttgart. And what they are finding is it's not just about stopping the slide. You can actually help children move ahead if you put all the right pieces together. So part of what we're trying to demonstrate is, look superintendent, look principal, this is really a good use of your resources. You've got NSL dollars, you've got Title I dollars. Let's put a little bit of that into summer learning and try to help stop the slide and move kids ahead.
Thanks, Angela. What you just saw was a confession from the moderator saying that I did such a horrible job of managing the time, but I was so interested in what everybody was saying that I didn't cut anybody off at all. So we're running a little short on time, but we do want to make sure that we hear from at least some of you. And I know that there are questions, but there are probably more comments than questions. So don't feel the need to put a question mark at the end of the comment. Let's just make the comment. Sir, ma'am, twice.
What resonates for me in this conversation is the need for us all to pull together as this group of individuals, but also recognizing the residual benefits to communities by activating community resources and realizing how important it is to mobilize communities and acknowledge the strength that families have, first of all, and communities have in turning grade level reading around. I don't think we can sit at a point of isolation and a point of policy making, but we have to make sure that the residents and the communities are involved and own the process. Also, when the executive director of a small community-based organization. Oftentimes you talked about data, and the commissioner talked about data, I think, or someone talked about being data-driven. As important as data is, we have to recognize that there are some intangible results that contribute and that drive data that we often, though important, are often not in a place and a space to be measured. But the community impact on parents being empowered, citizens being activated, juvenile justice being influenced. We often talked about or hear about the school to prison pipeline, recognizing that all benefits are not measurable in terms of going down on paper, but clearly the things that are important happen within communities, and communities are lifted by grade level reading. So we can't just concentrate completely on the level of education increase in the reading category as much as we look at community wholeness and community impact and the abilities of communities to be able to move forward based on programs such as this.
Thank you. We've got two more here, gentlemen, ma'am. And then over on the other side, we're going to move over there. But sir?
Okay, thank you. I want to join in the celebration of all of this. This is clearly wonderful, and the agency that you all have demonstrated is palpably wonderful. But I also think that one of the things that I worry a lot about in our withering of our civic life and our democracy today is, and you all, there were 3 times I heard the word joy and fun. I just recently read, and I commend this to everybody, the 2013 UNICEF report about who the happiest children on earth are. You know who they are? You know where we rank? We rank 26 out of 28, 29 industrialized nations. The Dutch have the happiest kids because they have the happiest families. And one of the understandings of what goes on in the learning lives of Dutch children is there is a lack of competition. There is complete and utter hyper-focus on how it is we encourage, support, love, engage, and support, and of course, infrastructure ways like health. Dr. Rodgers, you understand that probably. I raise that because David Kerp has just published a study which says the poorest and kids who are of color get tested the most. And this test-based pedagogy that is sort of surrounding, I can take you to 15 schools within 20 miles of here. And if you follow and shadow kids in those schools, what you're going to discover is a profound lack of joylessness in their learning lives. John Goodlatte asked this question in the study of schooling 30 years ago. At the end of his study, he said, why is there so much joylessness in our schools? So I raise that because I think the mental model of schooling has to be a part of this conversation. Otherwise, we can't test our way out. I had a neighbor, Mr. Miles, who said, you can't make a pig fatter by feeding it more. We can't keep testing kids. We have to support, motivate, encourage. And by the way, that would get at a lot of this high school dropout, boredom. So I'd appreciate any response to that.
Right behind you, sir. Let me just we'll come back to the panel.
I have a question. So, Commissioner Key, you referenced brain research. And so I was hoping that the panel could talk a little bit about the relationship between poverty, toxic stress, and its impact on brain development, health, and learning outcomes.
Okay, I'm going to ask the panelists to hold on that question.
30 more minutes.
Let me just take a couple more because I know that I was looking right here, but there was a hand over there someplace I saw. Going once. Oh, right there. Thank you.
Hello. I was just wondering, I caught like the middle of it, but I know you guys were saying that you test for like certain screenings, I would say. So if you miss, say that I didn't get tested, so how will we go about making programs for people like me that didn't actually get a screen?
Okay, we've got two questions and 2 comments. And let me ask each of the panelists to take a minute or so and respond, but I also want to make sure, we had given the panelists this assignment in advance, so I want to make sure, see if they really did it. I want you to take your, you don't know any of that. I want you to take what you've been thinking about and what you said, and I want you to get it into that crisp, we used to call the crisp short paragraph, the crisp sentence. Nowadays, they call it the tweet. Oh, well, tell us the thing that you're going to leave behind that somebody is going to put a hashtag on and get out. You don't have to start with it, but you got to end with it. Susan, you go first.
First of all, I want to address the screening. I know that not every community in Arkansas has early childhood, but we have found that when those children are in a program, that we can screen them, whether it's visual, whether it's hearing, whether it's developmental. We go ahead and serve that child right there. We had the educational co-ops around, the local education, the schools will help out in that way. So that's our goal, is it's not just the children in that program, but it's all the children in the community. And again, it goes back to the community. All those children are our children. The one thing I would like for you guys to think about is that, what is the state priority? Is the state priority, to me, we need to make it a priority that infants, toddlers, and preschoolers have that education in that beginning. If they don't have that foundation and we don't make it a priority and we don't guarantee that we have appropriate support and elements to help them grow up to be healthy, happy, and ready to succeed, then they're not ready when they get to kindergarten, first grade, fourth grade. So that's where it starts.
And is that your one-liner?
Yes, sir.
Okay.
So I've never been known to keep anything short, but there is a whole group of people from the AP, they call them pediatricians, and that's all they do is tweet. And I have never gotten a successful tweet out, but I will try. I will try today. I think walk away. Standardized screening tools, developmental screening tools at well child visits are proven to be effective at identifying children and are what's best for all of our kids. So that's my takeaway message. To address Sarah's comment, toxic stress is probably I think we could spend a whole day talking about adverse childhood experiences and the impact that it has on our children's going to school. I think for centuries, people who have cared for children, pediatricians particularly, know that the social environments that kids are growing up in heavily impacts their development, their health, and their ability to learn. Now, in the last several years, we have a remarkable and expanding amount of evidence to show the impact of that constant flight or flight response and the effect that stress has on the developing brain of our children. And we know that there's long-term healthcare consequences, that people who have more adverse childhood experiences are going to have more health problems when they get into their 30s and 40s, and they're going to have more difficulty finishing school, and their children are more likely to also experience these adverse childhood experience. There's several screening tools which we're kind of looking at implementing in Arkansas to help people who are taking care of children understand where these children are coming from, what their experiences have been, what their parents' experiences have been, and how we can best help them navigate through the system and get the interventions that they need. When you think about adverse childhood experiences, I think there's a long list of things that you kind of screen for. A lot of it's not just abuse, though. It's neglect. It's maternal depression. It's a parent that's been incarcerated. It's parental divorce, or even just discord. So all these things are things that we in this room have to work together. I can't solve it in the exam room. We can't solve it in our schools, but we can, as a community, as you said, we can all work together to make things better for our kids.
So I'm going to tackle, Mr. Ernst, your question about the testing. No, the farmer's not going to fatten the pig by weighing the pig over and over again, but the pig does need to be weighed. at the proper times and the proper intervals, and that will inform how much feed the pig needs. So, we have to do the right thing with assessment, and what we've seen probably over the last 20 years or so is a constant increase, and I think we've seen the peak, and I think we are starting to see the needle come back down. We're starting to see it come back, and what we're focused on here in Arkansas are assessments that give information that informs instruction, not assessments that just put a label on kids or a label on schools. So that's where we're headed with respect to assessment in Arkansas. Now, my tweet, now since we've talked about that idea, I think Twitter has allowed 280 characters now versus 140. But I'm going to try to keep it very tight and ask you all to think about this. If we are going to create a culture of reading in Arkansas, what can I do tomorrow to make that happen? That's the tweet, because it's not going to just be the teacher in the classroom, although that's an important role. It's not just going to be the commissioner or Dean Rutherford or any of these folks or any of these organizations. Individual decisions on a daily basis. What am I going to do to make this happen?
All right. So my takeaway is if we are going to move the needle 43 percentage points in the next 13 years, we have to double down. We need to make sure that every child gets every resources that's available to them, and we got to start at birth.
Let's thank everybody. Great job, panelists and new scholar in residence. Welcome.
I'm delighted.
All right. Thank you all for being here. Have a good afternoon. Thank you.